1, degree of freedom. It is capable of plantar flexion and dorsiflexion. Okay, there is, with dorsiflexion, a conjunct external rotation. With plantar flexion, there is a conjunct internal rotation. And we are not concerned with inversion or eversion here of the talocrural joint. That's not where that occurs. That occurs at the subtalar. Okay. So, examination here, I would say point your toes down as far as they can go. Any discomfort there? No. We're going to overpress. Any discomfort there? No. I'm going to let her come slightly out of that. Don't let me push your foot down. And resistance. Okay. Pull your foot up towards you. Good. Any discomfort? I'm assessing for mobility here as well. I'm going to overpress. And then let her come out of that slightly. And then I say, don't let me push you up any further. Okay. Pretty simple there. Now, typically during a examination process, I would do inversion and eversion here as well. At this point, I don't know if it's only the talocrural joint. All right, so we would say swing your foot in, hold this, right, and then we're going to overpress after asking, is that bothering you at all? Relax. Don't let me push you in any further. Again, assess for any type of weakness. Swing the foot laterally. Any issues, we're going to overpress, okay, and then we're going to bring it back. Don't let me move you. And there we go. Right? If we have local dysfunction here, problems in the ankle, problems in the subtalar joint, we're probably going to end up with weakness of all of these things. Right? Breaking weakness from a local pathology, reflex inhibition. Make sense? Now, if it's easier for you, and this is how I will tend to do it, it's easier for you for some of these tests to bring them back into this position and test strength here. Don't let me push this down. I'm perfectly fine with that. That's usually how I'll end up doing it. Okay? We can do eversion just by shifting our position there. Do inversion, relax here, bring that there, and then pull away, right? Not all that often that I'll actually do plantar flexion unless I really feel like I need to from a pain reproduction standpoint. It's such a strong muscle group essentially, that it's really hard to do real good breaking tests for that one. Essentially, if you're winning against them in plantar flexion, it's weak. If you're able to break that at all, it's probably weak, because you shouldn't be able to punch them with that one. Okay. Questions? That is active passive resistive testing.